Now, the growing burden of chronic disease is taking its toll on South Africa's mental health. With the country's alarming upward trend in chronic disease prevalence, we've seen the demand for antidepressants in the country increase by a staggering 39% over the past 5 years. Now, to tell us more, we're joined from Cape Town by Pharma Dynamics spokesperson Mariska van Aswegen. Pharma Dynamics is a generic pharmaceutical firm specialising in the treatment of depression and anxiety. Mariska, I thank you for joining us today.
Good morning, Annie. Nice to be here with you.
Mariska, if we can just start off, of course, with the study released in the beginning of the month. Your study focused specifically on the sales of antidepressants. Tell us, what exactly did those sales show, and at what years have you been looking?
As you mentioned earlier, we looked at the past 5 years and we used a data source, IMS data source in South Africa for South Africa-specific data that showed us that we did see about a 39%, almost 40% increase in the use of antidepressants in our country, and that stretched over the past 5 years.
Just tell me, Mariska, how have you accurately linked these figures to, for instance, as you are saying, those suffering from chronic medical conditions?
Firstly, the increase in the use of antidepressants can be due to various reasons, and one simple explanation can be the fact that people are more diagnosed and receive treatment for health conditions or mental health conditions, specifically depression then. But if one considers the fact that a healthy individual or a person that's considered to be healthy has a risk of for women between 10 and 25% and for men between 5 and 12% to develop depression or to get depression, and we compare that to individuals that suffer from a chronic condition whose risk is almost a third, at about 25 to 33%. We can link a certain degree of the increase in the use in antidepressants to the growing incidence of chronic conditions in our country. And then also if we link that to the fact that chronic conditions are becoming the leading cause of death in developing countries, and in South Africa alone it already contributes to about 40% of deaths that we see in our country, then there is a link between the increased risk of depression or the increased diagnosis of depression and then the growing incidence of chronic conditions in our country.
Mariska, instead of just describing antidepressants, are we seeing that doctors are really at least first encouraging their patients to maybe lead a healthier lifestyle, to maybe get other treatments? We know therapy is another option. Or are they really just describing antidepressants too quickly in these cases?
It is quite difficult to comment on that because every patient is individual, and not knowing what the history is of that patient and what that specific patient's condition is like, it's difficult to comment whether antidepressants are prescribed too easily. The important thing that we must remember, though, is that if you treat a patient who are still experiencing mild symptoms of depression, you do have the benefit of possibly a shorter duration of treatment, which obviously will benefit the patient. And what we've seen, it's often more difficult, like with any other chronic condition. If you wait too long, if the symptoms become too severe, then it becomes more difficult to treat those symptoms. So it is often better to treat sooner rather than later. But the important message is that you should discuss your symptoms with your doctor, and together with your doctor decide what the best treatment or course of treatment for you as an individual will be. And it can be various treatment options. So yes, psychotherapy is important, and that can be one of the courses of action that's decided on for you as an individual. But then also what we must consider is that there can be a combination of psychotherapy or pharmaceutical therapy, your antidepressants. But it is important to discuss all the options with your doctor and together make a decision what the best course of action for you as an individual will be.
And we also can't forget that there is a wide range of side effects that come with the use of antidepressants. Let's just touch on that. What can we see happening in some of the worst case scenarios?
Firstly, one must remember that side effects are part and parcel of any treatment. So whether or not it's treatment for depression or any other chronic condition, you should always be on the lookout for side effects, because there may be a different molecule that is more suitable for you as an individual, and therefore you need to talk to your doctor about any side effects that you may experience. For antidepressants specifically, there's a very wide range that you should be on the lookout for. It can cause nausea, it can affect your sleep patterns, causing insomnia. It can change your eating habits. It can cause you to eat more and then obviously result in weight gain. And if you are, experiencing the depression as part of or due to a chronic illness, like for instance a heart disease, a heart attack or stroke, then obviously gaining weight is not always beneficial in those conditions. So it's very important to talk to your doctor if you are seeing any sudden increases in weight or changes in your eating habits. Then it can affect your digestive system. It can cause dizziness. So there really are so many side effects to be on the lookout for, but be sure that you talk to your doctor if you think that it may be linked to your product. Decide together if it is maybe linked to your product, and then also make a decision whether or not your doctor should amend your dosage or change to a different molecule to see if you have an option that won't be associated with these side effects.
Mariska, on this channel, we've talked a lot about what we think about and what we know about mental health illnesses in our country, and we find that there are a lot of communities that don't receive the information that they need, that don't know how this can be treated. Just tell us, how educated are South Africans on this topic in general?
If we look at the stigma, and it's not only a problem in South Africa, it is a global problem with mental health issues. If we look at the stigma, there are so many people that that are prevented by the stigma to firstly try to find and gain more information. There's a lot of judgment that goes with mental health illness, and part of it is the fact that we refer to depression or anxiety in our everyday lives. You watch a movie and it makes you feel depressed, or you're anxious when you're waiting for your test results. But you are able to get over those feelings very easily, and you don't need help or treatment to get over those feelings. And sometimes we are exposed to the same condition or circumstances, losing of a loved one, for instance, and different siblings may experience that differently, and one may need treatment and the other one manage to deal with those emotions as they would normally do. So the important thing is that don't prevent the stigma from trying to find more information, because understanding mental health illnesses can save your life, firstly, and it can help you lead a normal life, because that's ultimately the message out there, is that it doesn't have to restrict you if you suffer from a mental condition. You can lead a normal, healthy life. But the important thing is to try to find a source, a reliable source of information, and to talk to your healthcare professional. That's why they're there, is to talk to them about these feelings. People close to you, often we see changes in the people close to us before they even realize it, and that's very important for us to be on the lookout for any behavioral changes in people who, for instance, has been diagnosed with a chronic condition, and to be aware and help them seek the right help. There are various options of where we can find help. Pharma Dynamics has got a helpline through SADC that's manned by counsellors, and people can go to the website and find out where they can get hold of the counsellors.
Mariska, thank you very much. I'll definitely make sure that we put up all of those details onto our Facebook page. Mariska van Aswegen, she is the spokesperson of Pharma